Welcome back, guys. My today's topic is metformin, and we all know metformin we use in our daily practice for the treatment of type 2 diabetes mellitus. We also know that it causes modest weight loss. And the good thing about this drug, if our beta islet cell is not functioning, definitely in the diabetes beta islet cell is not functioning, so we still can use metformin. So what drug require the beta islet cell function? It is sulfonylurea. Yes, and we know that it is first line therapy in diabetes mellitus type 2. These days metformin are using in the PCO. And what else? We can use metformin in renal failure. Yes, we cannot use this drug in the renal failure patient. It is contraindicated. The famous adverse effect we know about the metformin is lactic acidosis. These things we know about the metformin. Now I am going to emphasize on the mechanism of action of the metformin. So what is its mechanism of action? I am going to draw the hepatocyte cell, and we know that cell has lipid bilayer, there is channel protein, this is lipid bilayer, of course is tail, head, tail of the lipid bilayer, and there is a receptor which I left the place for this, which is 7 transmembrane, and it is of glucagon receptor. We know that glucagon is GS couple. It is converting into the cyclic AMP through the enzyme adenylate cyclase. And here is our mitochondria, the powerhouse, and what we said, that is hepatocyte cell. Now what happened? We give our drug metformin. Metformin through the channel protein come and inhibit the enzyme which is located in the inner mitochondrial membrane. The name of enzyme is glycerol 3-phosphate dehydrogenase, which convert glycerol 3-phosphate to DHAP, and DHAP is going to glucose. We know this reaction is interconversion. What else could metformin is doing? Metformin is doing two things. First, it inhibits this enzyme, and of course the metformin, the other function of the metformin is inhibiting the electron transport chain of complex 1. So when complex 1 is inhibited, there is no ATP, so ATP is decreased. Our powerhouse is not making ATP. What I said in the mitochondria, it is inhibiting the glycerol 3-phosphate dehydrogenase and the complex 1 of the electron transport chain. So what happened? We have decreased ATP but increase ADP and increase AMP. What it do? The level of the AMP is increased, so it is inhibiting the adenylyl cyclase, that glucagon function is inhibited. So what as it is doing? it is stimulating the glycolysis but inhibiting the gluconeogenesis. So increased level of AMP and decreased ATP level of the ATP causes gluconeogenesis to be inhibited through the enzyme which is fructose 1,6 bisphosphatase. And what the other thing is doing? It also is stimulating the glycolysis. How? Through the enzyme phosphofructokinase 1, which is stimulated by increased AMP. What other thing activate the phosphofructokinase 1? It is fructose 2,6 bisphosphate. Okay, so when this is stimulated, then it is stimulating the glycolysis. So glycolysis is stimulated but gluconeogenesis is inhibited. Now what happened next? We see that these levels also lead to the activation of AMP kinase. AMP kinase is phosphorylating. So what happened when this is phosphorylated? When this is phosphorylated, it is inhibiting the enzyme which is acetyl CoA carboxylase. And it inhibits this enzyme. So this enzyme is no more functioning. So what happened? The fatty acid synthesis will be stopped. Fatty acid synthesis will be stopped and fatty acid oxidation is stimulated because no malonyl CoA is there, and we know that malonyl CoA inhibiting the fatty acid oxidation. So what I said, that fatty acid synthesis is inhibited but the stimulating of fatty acid oxidation effect. So this way is stimulating the insulin sensitivity. Now let's summarize this all. Now what I said is that we are inhibiting the gluconeogenesis, we inhibit the glucagon, we inhibit the fatty acid synthesis, and of course we are inhibiting the electron transport chain complex 1, and we are inhibiting the mitochondrial glycerol 3-phosphate dehydrogenase enzyme. And what we are stimulating? We are stimulating the glycolysis and we are stimulating fatty acid oxidation. So there is no gluconeogenesis is going on. Then what happened? If the lactate is formed through the anaerobic glycolysis and it moves into the liver cell, but gluconeogenesis is inhibited, so lactate will be increased and our patient will suffer with lactic acidosis. Okay guys, I hope this clear. And if you find my lecture interesting, then don't forget to like and subscribe. And for more videos and lecture, please subscribe, because in the next video I am going to give the lecture on the gluconeogenesis, gluconeogenesis and many more, so that you can appreciate these effects. Thank you.